So tuanze orthopedic nursing. So our course outline, tuko na broad specific objective of the lesson. So the broad objective ni kujua everything about the orthopedic nursing. So definition ya terminologies zenye zinatumika kwa orthopedic nursing, kureview the anatomy and physiology, that is the bone formation, functions of the bones in the body, the joints, types of joints in the body, disorders of the bones. Tuko na examples kama scoliosis, kyphosis, lumbar lordosis. Tuko na metabolic disorders of the bone. So some of the metabolic disorders of the bone include osteoporosis. So you've heard about osteoporosis. We have Osteomalasia. Na tuko na bone tumors. Na tuko na Osteomyelitis. So we will go into fractures. You know the bone. We know it's just about the bone. The topic, this unit is about our bones as humans. So it can fracture. So we'll define the fractures, we will classify the fractures, and we will go into the specific types of fractures. After that, we will check the bone healing process. It's a process. Then the factors which enhance the bone healing. The principles of fracture management. So we have principles of how we manage fractures. Traction is one of the principles, but we will cover it in detail later. So then definition, types of definition of traction, types of traction, indication of traction, tunatumia saa ngapi traction, then principles of effective traction, then specific care of patient on traction. See, you've seen those patients in the ward wenye wanakwanga wamewekwa kitu ya kuvuta. Those are tractions. Also, we have what we call casts and splints. Definition of casts and splints, the purpose, then the nursing management of a patient, of a patient on casts and splints. We have the complications of fractures. Of course, we have early and delayed complications we will cover. We have soft tissue injuries, which includes contusion, sprain, and strain. These are common, especially among children. Then joint disorders. We have what we call rheumatoid arthritis, osteoarthritis, joint dislocation, and gout. Also, we have amputation. We will cover amputation, definition of amputation, indications of amputation, and then levels of amputations, pre-operative and post-operative care of amputation. So first, all what we have said in the course outline, we will cover in 2 different videos, if not 1 full video, because it's a bit long, but the last thing will be amputation. So we will review the anatomy and physiology of the bones in the body. So the musculoskeletal system iko na bones, iko na joints, na iko na muscles, na iko na tendons, na iko na ligaments, and also basi of the body.
Nini? Basi of the body nini?
The basi of the body. The basi of the body, it's okay, we know tendons in a joint, two bones. Basi in a joint, 2 soft tissues. The bone is a type of a connective tissue. It is made up of water, living cells, calcium, phosphorus as its main components. So cells ina make the bone ni tatu. Kuna kitu inaitwa osteoclast. Before that we have osteoblast. Osteoblast ni the bone forming cell, sawa. We also have the osteoclast, bone resorption cell. We have the osteocyte, mature bone cell. So ni osteoblast, osteoclast and osteocyte. So we have the osteoblast, hiyo ni the bone forming cell. So then osteoclast, that is the bone resorption cell. The mature cell inaitwa osteocyte. The mature cell, mature bone cell ni
Osteocyte.
So that is a picture of the bone. So on top we have the epiphysis. In the middle we have the diaphysis. And then the bottom we have the epiphysis. Also on the right we have the cartilaginous bone, the narrow cavity, that is the medullary cavity. We have on the opposite side we have the periosteum, we have the blood supply, we have the compact bone, the epiphyseal line, then the epiphyseal line, then the articular cartilage. So we will understand in detail as we go further. So the bone is the hardest tissue in the body, and when developed it comprises of 20% water. Did you know that the bone is 20% water?
No.
Now our viewers, you know that organic matter 30% to 40%, then inorganic materials 40 to 50%. So pia tuko na inorganic, the inorganic matter rather ina consist mineral salts kama calcium na phosphate, sawa. Organic materials ina consist of bone cells and tissues. Bone cells tumesema ni osteoclasts. Lenye imesha mature tumesema inaitwa osteo. We can go back to the first slide. Ni osteocyte, that is the mature. So hiyo ndio bone cells. So kuna two types of bone tissue, kuna compact na cartilaginous. Bones iko mostly covered na periosteum, which is a vascular fibrous membrane, na periosteum ina give attachment to muscles. So unaona part ya juu ya bone yako inakuanga na periosteum. Let me not use you. Let me just say the top part of the bone ni periosteum, na hiyo ndio inashikana na muscles. So we now get what is a periosteum. So continuing, types of bones. So tumejua kuna type mbili ya bone tissue. Bone tissue ni compact na cancellous. Tutajua in detail. Types of bones, tuko na bones can be classified as short, that is metacarpals, irregular, 2. Then number 3 inaweza kuwa classified kama flat ama synsamoid. Synsamoid ni sternum, ama long bones like the femur. We know the femur is a long bone. The femur is located in which part of the body? The leg, the hip. So tunaenda kufanya bone development. Hii process ya bone development inaitwa osteogenesis. The process of bone formation begin before birth. Sawa. And it is not completed until 25 years. So most of us who are maybe viewing this video can be below 25. So it means your bone are still continuing to form. Haiko really fully formed. So if you are of a medium height, you can continue getting tall. So long, short, or irregular bones develop from cartilaginous models. Cartilage models. So ossification is the process by which the bone matrix, that is the collagen fibers, and the ground substance is formed, and hardening materials. So examples are hardening materials in the calcium salts are deposited on the collagen fibers. So we have noted that ossification is in the process in a bone matrix in a form na ina harden, na pia kwa hii process utanote kwamba calcium salts zinakuwa deposited kwa hizo cartilaginous fibers. So bone matrix basically ina involve vitu mbili, the cartilaginous fibers na ground tissue ama ground substance. Na hii cartilaginous fibers lazima iadeniwe na calcium salts ndio ikue the mineral which makes the bone to be hard. So results from deposits of both organic and inorganic bone elements. The further develops allows for a clearer demarcation of the diaphysis. So from our pictures, we can see the diaphysis. Diaphysis, it's a result of the hardening of the bone matrix, the collagen fibers, which is as a result of addition of calcium salts, which are deposited there. Also, osteoblasts and osteoclasts are involved in bone formation. Those are the cells which we talked about. Osteoblasts are the first cells, then osteoclasts are the mature. Okay, the mid, which is involved in bone resorption. Then the osteocytes is the mature. Osteoclast is the mature bone cells, yeah. So continuing in our review, the human skeleton is divided into two main parts: the axial skeleton and the appendicular skeleton. Axial skeleton refer to the central, and the appendicular refer to the attachments. Axial skeleton is made up of the skull, the vertebral column, the ribs and the sternum. Appendicular skeleton tumesema ni attachments. Consist of the shoulder girdle, consist of the upper limbs. Those are the what we call the hands, but of course in orthopedic hatuwezi ita hands, we will call it tunaita upper limbs. Then tuko na pelvic girdle na tuko na lower limbs kwa miguu yote kutoka kwa hips hadi chini. So the number of bones in the human body is, can you guess? Without looking, 206. So basically that is a picture of the human body bones. So from the top we can see the cranium, we can see the facial bones, we can see the mandible, Mandible is the lower part of the mouth. We can see the sternum, right? You can see the costal cartilage. We can see the vertebral column. You can see the ilium. You can see the pelvis generally. Also, that's a knee joint there. You can see the tarsals. You can see the calcaneus. On the middle is the sacrum, and on the right side you can see the clavicle there. You can see the scapula. Scapula is located where it is pointed, the back of the shoulder. You can see the humerus. We can see the radius. We can see the ulna. We can see the carpals, metacarpals and phalanges. We can see the femur. We can see the patella. We can see the tibia. We can see the fibula. We can also see the metacarpals and phalanges. So with time, you will know all these bones. But you should, as per now, you should be knowing the most common bones, such as the clavicle, the scapula, the sternum, the humerus, the radius, the ulna, the carpals, metacarpals and phalanges, the femur, the patella, the tibia, and the fibula, and maybe the metatarsals and the phalanges. Mandible, of course, is another common bone. So let's continue. The functions of the bone. Without a bone, you're nobody. So it provides the basic framework of the body. Pia, the points of attachment ya muscles na tendons. Pia ina form a reservoir ya calcium. Calcium inaenda kukaa huko, so ina form reserve. Kumbuka mwili inaweza toa calcium kwa bones kama imekosekana. Sawa. Pia ina permit movement ya mwili as a whole by forming joints. Pia ina form boundaries of many cavities which provides protection to organs. So see, of course, bones zimeform boundary. For example, kama ribs. Si ni boundary ya ribs na sternum, ni boundary ya the chest organs zenye ziko ndani. Ni boundary ya heart, boundary ya lungs, so inazuia, si ndio, ina form protection, si ndio? So ina contain red bone marrow. Tunajua vizuri the red blood cells inaformiwa wapi? Ama the blood cells in general inaformiwa wapi?
Red bone marrow.
Yeah. So joints, definition ya joints ni points in the body at which bones attach to each other. So ina form points at which the many movements can be made and positions can be changed. So kuna 3 types ya joints. Ya kwanza ni fibrous joints. Fibrous joints iko fixed na immovable. So for example, joints between skull bones, the ones we commonly call the sutures, the coronal suture, the sagittal suture, the lambdoid suture. So those are the fibrous joints zenye ziko fixed and immovable. Sawa. Fixed and immovable. Also tuko na ya pili inaitwa cartilaginous joints. Cartilaginous joints inaweza move slightly. So iko na cartilage between the two bones. For instance, joints between the vertebral bones inaweza move tu kidogo. Alafu tuko na joints zinaitwa synovial ama diaphosis joints. So tunakumbuka kitu inaitwa synovial fluid. Synovial fluid basically ni fluid yenye ilikuwa inafanya joints ina move freely. Ikiisha, si friction inaanza. So for example, joints ni zile joints zenye ziko na ball and socket, kama in joints, the gliding joints, the pivot and saddle joints. Kama joints za kujoin femur na tibian fibula, ndio. So tunaweza rudi nyuma kidogo tuangalie. Hii join ya patella hapa, femur and tibian fibula. Cartilaginous joints tumesema ni joints za vertebral column, inajoiniwa na cartilages. So tuseme between lumbar 5 na 6 kuna cartilage kwa hapo. Lumbar 4 na 5, sorry. Also tuseme between the cranium, si kuna frontal part ya cranium na kuna hiyo part ya katikati hivyo. So kuna join kwa hapo hivyo. Hizo zinaitwa it's immovable kabisa. Those are the most immovable joints. Ndio tunaita the fibrous joints. Sawa. Ya mwisho ni the movable part. Kama hii join ya patella hapa, the join between the femur and the tibia and fibula, si ndio? Na tukuna join yenye ina join humerus na radius and ulnar, si ndio? Hii hapa ya mkono. So hiyo inaitwa synovial ama diaphoresis joints. So twende next slide. Movement ya joints. So kuna kitu inaitwa flexion. Flexion ni bending forward ama backward. For example, the knee joint. Ebu inua knee joint yako, bend forward na backward. Hiyo ni kuflex. Yeah. Basically mostly ni kubend forward. Then extension ni kustraighten ama kubend backward. Then abduction ni kumove away from the midline. For example, kumove the arm ama leg away from the body laterally, hivi kumove away. Okay, for the viewers, you just move your hand away from the body. That is abduction. Then adduction ni movement towards the middle of the body. So adduction, kama mkono yako unaweza move iende towards the stomach. Mkono ya left to move towards the stomach, hiyo ni adduction. Then eversion ni turning the sole of the feet outward. Then inversion ni turning the sole of the feet inwards. Supination ni turning the palm up. Then pronation ni turn the palm downwards. Rotation ni kumove in the long axis. Then circumduction ni kurotate, a combination ya adduction, flexion na extension. So disorders of the bones inaweza result from, first disorder inaweza result from altered growth and development. Pia inaweza result from metabolism, disordered metabolism, neoplasm, that's a cancer, injury and their complications. So tumepata ya kwamba disorder ya kwanza inaweza kuja due to growth and development, ya pili ni neoplasm, ya tatu ni disordered metabolism, ya nne ni injury and their complication. So these disorders occurring during growth and development include femoral anteversion, where there is internal torsion or rotation of the femur, and toeing out of the feet, where the foot flat and the toes spread out. Many of these conditions resolve by themselves while a few may need surgery. So tunapata kwamba femur ina undergo anteversion. Anteversion alafu pia inaweza undergo kuna ni internal torsion ama rotation ya femur. Haiko straight, imerotate tu internally. Pia kuna toeing out of the feet where the foot flat ama toes zimeachana, spread out. So first disorder ya tunaenda kucover ni scoliosis. So lakini kabla ni tufanye scoliosis, nataka ujikumbushe vitu mbili. Ya kwanza ni the 3 bone cells. Nakupea sekunde 3 ujikumbushe the 3 bone cells, then the 3 types of joints. 3 seconds. Kama umepata ukumbuki, unaweza pause hii video alafu urudi nyuma uangalie answers. Let's continue. Scoliosis is the lateral deviation of the spinal column. Causes ya scoliosis ni nini? Idiopathic ama certain diseases kama polio. Imekwanga imedeviate lateral, imesonga kando hivi, haiendi straight, haiko tu straight. So ina manifestiwa na uneven shoulders, prominent scapula, also tuko na asymmetry of the flanks ama asymmetry of the thoracic cage. Pia tuko na the hip hams. So scoliosis tu ukisikia ujue ni spinal column imedeviate lateral, imesonga kando, na utapata shoulders haziko sawa, scapula iko prominent, kuna iko prominent kushinda ingine. Ukiangalia flanks hazifanani, pia thoracic cage hazifanani, na hip, that is a spelling error, the hip arms. Kuna hip moja imetoka kushinda ingine imeingia ndani. So tukuje kwa kyphosis after scoliosis, an exaggeration of the curvature of the thoracic spine. So kuna spine ya hapa juu ya kwa thoracic area inaweza lead to change in volume of the thoracic space, na pia inaweza affect functional capacity ya lungs. Thoracic spine so unaijua hapo nyuma, yeah. So tukuje kwa lumbar lordosis. Lumbar lordosis is an exaggeration of the curvature of the lumbar spine huko chini, then ina sway back. Normally inaoka during growth and development. So condition ya kwanza tumekava ni scoliosis, ya pili ni
Kyphosis,
ya tatu ni
lumbar lordosis.
So tujikumbushe, scoliosis ina deal na spine yenye iko curved ama iko deviated rather in laterally. Alafu kyphosis ni the thoracic spine imecurve. Alafu lumbar lordosis from the word lumbar, ukiona tu lumbar ujue ni lumbar spine imecurve. So tukuja kwa osteoporosis. Osteoporosis ni nini? It's a disorder in which the rate of bone reshaping ama bone resorption iko greater than the rate of bone formation. So results in loss of the organic matrix and mineral content. the bone is then inakuwa brittle, inakuwa fragile na pia ina fracture easily. Iko common kwa watu wazee, elderly, na pia postmenopausal women washafika menopause. Pia watu wenye wako na Cushing syndrome na pia wenye wako on steroid treatment, corticosteroids. So manifestations ya osteoporosis ni nini? Ni pain and spontaneous fractures. Mtu anavunjika ovyo ovyo bila anything. Pia some cases kuna wedging na collapse of the vertebral column na ina cause loss of height. Mtu anaanza kuwa short juu vertebral column inaanza kuanguka. Pia inaitwa kyphosis. Daza pia inaweza lead to kyphosis. Kyphosis tumesoma hapo nyuma na tukapata ni curvature of the thoracic spine. So osteoporosis ni the rate of bone reshaping ama resorption inakuwa greater than the rate of the formation. Sawa. So hapo ndio tunaweza ona picha ya osteoporosis ama the deterioration of the vertebral support, that is kyphosis. The major risk factors ya osteoporosis ni nini? Ni female sex, miaka zikiongezeka, msa akifika menopause ama mama akifika menopause. Pia race, kuna race iko more affected than the other races. So risk factors for osteoporosis and related fractures. So kwa hii table tunapata kwamba kuna the major risk factor, personal history of fracture in adulthood. Then utapata kwamba estrogen iko deficient, especially in women less than 45 years of age. History of fragility fracture in first degree relative. Pia kuna dementia, kuna excessive alcohol use, current cigarette smoking, low body weight, recent falls. So basically on the left side, hizi ndio vitu zenye zinafanya mtu anapata osteoporosis, kama kusmoke cigarette, kutumia pombe sana, kuwa na low body weight, pia kutumia corticosteroids. So tuendelee, but usisahau pia something like low calcium intake kwa diet ama poor health inaweza cause osteoporosis ama fractures. So hapo tunaona the normal and osteoporotic bone architect. The normal bone hapo na osteoporotic bone. So the osteoporotic bone iko sama, unaona ina katika. The rate of bone reshaping is more than the rate of bone resorption or the bone growth. Sorry for that. So let's continue. Causes ni diabetes, rheumatoid arthritis, leukemia. Causes osteoporosis. So pathophysiology of osteoporosis ni nini? In the normal bone forming process, bone remodeling occurs in the same pace as bone resorption. So tumesema bone resorption ni bone reshaping, inaokaa in the same pace. Lakini osteoporosis tunapata kwamba there is rapid bone loss. This leads to the thinning of the lamella with deformity and later collapse. The bone may easily fracture. So the rate ya bone remodeling iko higher than the rate of bone resorption. So genetics, watu Caucasian ama Asian wako more affected na bone loss, females ama female family history ama small frame. Then age, watu wamefika menopause ama watu wamezeeka, na pia wanaume wako na low testosterone ama decreased calciferol. Hormones kama estrogen, calciferol, estrogen ina inhibit bone loss. Na pia reduce nutrient needed for bone remodeling. Physical exercise, mtu mwenye anaishi sedentary lifestyle hataki kufanya exercise mingi ama kutembea. Pia lack of weight bearing exercise, low weight or body mass index. Bones need stress for bone maintenance. So tumepata kwamba pia bones zinahitaji some stress, zinahitaji some exercise ndio iko maintained. So lifestyle choices pia, caffeine, alcohol, smoking, lack of exposure to sunlight. Yani msana anashinda kwa nyumba, hataki kuota jua, ina reduce osteogenesis. Now tumesema osteogenesis ni bone formation in bone remodeling. Pia medications kama corticosteroids, anti-seizure medications, heparin, thyroid hormone. Comorbidities such as anorexia nervosa, hyperthyroidism, malabsorption syndrome, renal failure ina affect calcium absorption na metabolism. Then so hizo medications ina affect, tumetaja kama heparin, hizo anti-seizure medication, corticosteroids ina affect absorption ya calcium, na calcium ni one of the elements needed for bone formation. So bones itakuwa weak. Nutrition, mtu anachukua low calcium diet, low vitamin D intake na pia low phosphate intake, rather high phosphate intake. Hiyo ni kukunywa carbonated beverages sana. Then inadequate calories, ina reduce nutrients yenye inahitajika for bone formation. So risk factors tumezitaja, hatutaki kuzirudia tena, bado tu ni hizo. So kupunguza itakuwa just the opposite of the risk factors. Kupunguza the occurrence of osteoporosis ni kukula high diet ya calcium na vitamin D, kustop smoking, kustop ama kumoderate alcohol and caffeine consumption, na pia kufanya regular weight bearing exercise of which the normal the recommended weight. Also kutembea out of the house. So how can we diagnose this osteoporosis issue? Kitu ya kwanza ni kufanya history and clinical features. Pia kufanya x-ray. Another thing, kuna kitu inaitwa quantitative ultrasound studies of the heel. Clinical features zake ni acute onset back pain. So utapata tu mtu anakaa hadi anasikia uchungu kwa mgongo. Na pia especially kwa the lower thoracic region, na kuna kyphosis, those are postural changes. So tuna manage aje ama ina managewa aje? Prevention of the condition ni kupitia early administration of calcium supplements na pia vitamin D na fluoride ndio strengthen bone. Pia compare health messages about dangers of smoking na alcohol in excess. Pia women wenye wana approach menopause wanapewa hormonal replacement kama wako susceptible kupata hii osteoporosis. Pia kuchange lifestyle, of course tumeongelea alcohol, smoking na vitamin D na calcium kwa diet. Medications pia of course kwa mtu wako susceptible, if there's an option asitumie hizo medications zenye zina cause osteoporosis ama loss of calcium ama poor calcium absorption. Pia medications zina increase bone formation zinaweza tumika kama for TO. So osteomalasia and rickets, our next condition. So terms ina refer to the same process occurring at different ages. Both cases kuna deficiency ya vitamin D na ina characteriziwa na inadequate mineralization of the bone. Kama kuna deficiency ikioccur before fusion of the epiphysis plates, when the bones get deformed, then the bones rather inakuwa deformed. Fusion ikioccur, kama kuna deficiency before fusion ya hiyo epiphysis plates, then bones inakuwa deformed. But if kama fusion imesha occur, the bones ina bend easily. Rickets therefore inaoccur kwa children na osteomalacia inaoccur kwa adults. Hizi conditions zinakosiwa na malabsorption syndrome, pia kutoenda nje kwa jua na pia kutumia excess secretion ya vitamin D. So what is the pathophysiology of osteomalacia? So tumesema tu ni vitamin D in excess, ni deficiency of activated vitamin D rather. Tunapata hiyo kitu inaitwa osteomalacia. Another name of vitamin D ni calcitriol. Ina promote calcium absorption from the gastrointestinal tract na ina facilitate mineralization ya bone. Tumepata vizuri kwamba calcium is needed kwa bone formations, no? But before calcium is being absorbed from the GI tract, that is the stomach, the intestines, tunahitaji kitu inaitwa activated vitamin D. That is the calcitriol. Kama iko deficient, inamaanisha calcium haitakuwa absorbed from the GI tract. So the supply of calcium and phosphate in extracellular fluid iko low kwa hii osteomalacia. Now without adequate vitamin D, calcium and phosphate are not moved to calcification sites in the bones. So haitatoka kwa GI tract, kwa stomach, intestines, wherever, ienda hadi kwa bones, the sites of calcification, where calcification inamaanisha tu calcium inakuwa calcified kwa bones. Sawa? So osteomalacia inaweza result kwa failed calcium absorption, ina result from failed calcium absorption, malabsorption syndrome, ama from excessive loss of calcium from the body. So gastrointestinal disorders kama chronic pancreatitis, in which fats are inadequately absorbed, cause osteomalacia through loss of vitamin D, along with other soluble vitamins and calcium, and later being secreted in the feces with fatty acids. So umepata kwamba kama mtu pia kuna condition kama the chronic pancreatitis, tunapata kwamba atapoteza vitamin D mingi, na vitamin D ndio ilikuwa inahitajika kumove calcium kutoka kwa GI tract hadi kwa bones. So liver and kidney diseases can produce lack of vitamin D. Also we have severe and also before we continue, the liver and kidney are needed to convert vitamin D into its active form. The active form is called calcitriol. So Then severe renal insufficiency ina result kwa acidosis. The body inatumia the available calcium to combat acidosis. Hiyo acidosis yenye inafanyika due to renal insufficiency. And parathyroid hormone PTH stimulate the release of skeletal calcium in attempt to establish a physiological pH, the pH ya mwili. So during the continuous drain of the calcium from the skeletal system, bone fibrosis inaoccur and bone cysts zinaform, na tunapata osteomalacia, bones zinaanza kubend, si ndio? Ama the other way around kwa mtoi rickets. Hyperparathyroidism ina lead to bone decalcification due to and thus to osteomalacia kwa juu ina increase phosphate excretion kwa urine. Pia prolonged use of anti-seizure drugs kama phenytoin. So the malnutrition type of osteomalacia, that is deficiency in vitamin D, often associated with poor intake of calcium. So clinical manifestations za osteomalacia ama rickets, kuna softening or weakening of the skeleton, ina cause pain and tenderness to touch, bowing of the bones, that is bending of the bones, and also pathological fractures inafanyika. Physical exam utapata kuna skeletal deformities kama hiyo spinal kyphosis, that is the thoracic part, the board legs in rickets, we know that how rickets occurs. Pia tunapea patients, we give patients to it gives patients unusual appearance na waddling of or a limping gait. Sawa. So kuna muscle weakness na unsteadiness. So what is so glaring here, kuna weakness of the skeletal muscles, or not muscles, rather skeletal bone, na pia kuna bowing of the legs in rickets ama osteomalacia. Ni same na rickets tu, osteomalacia. So kuna muscle weakness na kuna unsteadiness. So kuna laboratory studies to show low serum calcium ama phosphorus levels and a moderately elevated alkaline phosphatase concentration. So management yake to summarize ni kupeana supplemental calcium, vitamin D, kumpeleka mtu aote jua, sunlight. Pia kupeana hizo foods zenye ziko kwa diet zenye ziko rich in vitamin D na calcium kama maziwa na cereals. Pia correct surgical correction ya deformities if need be. Also psychological, physical and pharmaceutical measures can be needed to reduce the patient's discomfort and pain. So caring for the patient with osteoporosis ama osteomalacia ama rickets, an adult patient. So basically tumepata tu ni ku-add calcium kwa diet na kumpea supplements. Pia kumpea hormonal estrogen replacement na pia calcitonin repair treatment. So calcitonin treatment, which acts by blocking the effects of parathyroid hormone on the bone resorption ama bone, that's bone shaping. The bone etidionate, that is etidionate disodium, also inhibits bone reshaping ama resorption. So ina inhibit weight bearing measures to prevent osteoporosis. We keep the patient with osteoporosis ambulated to prevent further loss of the bone substance. Tusahau kuna kuweka measures to avoid fractures pia education ku avoid accidents kwa home ama mahali popote kama ku avoid slippery floors na pia kuvaa shoes zenye ziko na firm sole. Pia kupea supplementation ya vitamin D. Calcium and phosphorus intake may also be needed. Next ni bone tumors. So bone tumors, these are primary tumors or metastatic tumors from primary cancers elsewhere in the body. Benign tumors of the bone and soft tissue are more common. So ni kama cancer yenye tumor inataka cause cancer, lakini benign I spread sana, haijaanza kuspread sana, metastatic ime spread. So generally benign tumors are slow growing and well circumscribed and present with few symptoms. Benign primary neoplasms of the musculoskeletal systems ina include, ya kwanza ni osteochondroma ama chondroma ama bone cyst, e.g. aneurysmal bone cyst. Then kuna osteoma, kuna rhabdomyoma and fibroma. So what is osteochondrioma? What is an osteochondrioma? Is the most common benign tumor. Hii ndo utasikia mara mingi. Then it occurs as a large projection of the bone at the end of the long bones. So it's a painful tumor that occurs in children and young adults is the osteoma. Giant cell tumors, that is osteoclastomas, are benign for long periods. So basically tushike hizo osteochondrioma, osteoma na giant cell tumors. So osteochondrioma tumesema ni large projection at the end of the bone, large projection of the bone at the end of the long bones. Then tumesema a painful tumor yenye inaokaa kwa young children and young adults ni osteoma. So what are the malignant bone tumors? Primary malignant yenye zina spread kabisa haraka. The primary malignant musculoskeletal tumors are relatively rare, iko very rare, na pia ina arise from connective and supportive tissues. Those are sarcomas and bone marrow elements. Pia ina include multiple myeloma, kuna osteosarcoma, kuna ingine inaitwa chondriosarcoma, kuna ingine inaitwa fibrosarcoma. So ukiangalia tofauti ya hizi na zile zingine, hizi zinaishia sarcoma, ile ingine inaishia chondrioma, ndoma, inaishia hiyo ndroma ama osteoma. So pia tuko na soft tissue sarcomas, ina include liposarcoma, fibrosarcoma of the soft tissue and rhabdomyosarcoma. So the usual tumor sites include the pelvis, the femur, the humerus, the spine, the scapula and the tibia. So those are the areas where we have tumors ama cancers most of the time. So metastatic bone disease iko more common in any primary bone tumor. So to the next, the conditions associated with bone tumors are infections, pathological fractures ama anemias among others. Manifestations of bone cancer ina include bone pain, mtu anasikia uchungu kwa bone for a very long time, especially over a week. Pia kuna unexplained swelling kwa particular bone. Pia warm skin over the affected bone, prominent veins inakuwa prominent kwa hiyo skin, na pia kuna weight loss na malaise na fever. So iko very rare in adults, hizi bone tumors, and they rapidly metastatize and cause bone destruction and organ involvement. Example ni multiple myeloma. hiyo tumesema ni malignant tumor. So management ya hizi matumor ni nini? Si ni kama tu kumanage cancer. Cancer inamanagewa mara 3. Ya kwanza ni kufanya surgical excision, hiyo ni kutoa, ni kwenda chemotherapy, hiyo ni dawa za kuchoma hiyo cancer cell growth. Pia wanaweza penda steroids ya kusuppress. So however, both these management methods increase patient susceptibility to other infections. Good infection prevention iko muhimu sana. In osteoblastoma and sarcoma, chemotherapy and surgery and radiation may also improve survival rates. Treatment of metastatic bone cancer ni palliative. Palliative ni improve the quality of life ya patient, na of course relieve pain na pia manage familia issues kuhusu the patient. The therapeutic goal ni relieve patient pain na discomfort na promote quality of life of both parties. So management ya metastatic bone tumor tumesema ni pain management, wanatumia strong opioids. Pia kuna structural support ama stabilization of the to prevent pathologic fracture. Pia tutapata kitu inaitwa hypercalcemia from breakdown of bone treatment, which includes hydration with IV administration of normal saline solution, diuresis, mobilization and medications such as biphosphonates and calcitonin. So basically, because inactivity leads to loss of bone mass and increased calcium in the blood, the nurse assists the patient to increase activity and ambulation, blood product transfusions, restore hematological factors. So the goals of management could relieve pain, to enable the patient to maintain preferred activities, na pia kupromote ama enable the patient accept body image yake yenye na resolve kutoka chemotherapy, radiation ama surgery. Pia kuna decrease the possibility ya injury na kufunza patient about the disease progression na prognosis. Kuna pay attention to pathological fractures, spinal cord compression and limb amputation. So this is ensured through the affected extremities must be supported and handled gently. Use of external supports, that is prescribed weight bearing restrictions, must be followed. Use of assistive devices should be implemented safely. So basically, kuna monitoring of complications because there is delayed wound healing. Adequate nutrition should be factored in. So coping skills, to just summarize, they should be taught on how to allay or relieve fears and feelings, especially for the malignant bone tumors. So tumemaliza hiyo condition. Tunakuja sasa kwa kitu inaitwa osteomyelitis. So osteomyelitis ni infection of the bone also. So the bone inakuwa infected by 3 modes. Ya kwanza ni extension of soft tissue infection, e.g. infected pressure or vascular ulcer ama incisional infection. Kuna direct bone contamination from bone surgery, e.g. open fracture or traumatic injury kama gunshot wound. Kuna hematogenous in brackets bone spread from other sites of infection. Hiyo hematogenous ni kupitia damu most of the time, bloodborne rather. So kama infected tonsils ina spread hadi huko kwa bone, infection inaanza huko. Boils, infected teeth. So inaanza, unajua infection pia inaweza anza kwa teeth na ifike kwa bone. Pia kuna upper respiratory infections na of course lower respiratory tract infections. Patients wenye wako high risk ya ni wale wenye wako poorly malnourished, na wale wenye wamezeeka, na watu obese, na watu wenye wako na impaired immune systems kama chronic illnesses of course kama diabetes, na pia wenye wana receive long term corticosteroid therapy. Kumbuka corticosteroid therapy tulisema kwa video zetu za kitambo kwamba iko immunosuppressive. So tumejua osteomyelitis ni infection of the bone. It's an infection like any other infection which can infect anywhere. So the bone gets infected through 3 ways. First way ni extension of the soft tissue infection. Kama kulikuwa na soft tissue infection inafika hadi kwa bone sasa. Kuna direct bone contamination from bone surgery. Na pia kuna ukisikia tu ima inamaanisha damu. Hematogenous infection inatoka kwingine hadi kwa bones. So most of the time hiyo ya surgery utapata kwamba hiyo direct bone contamination, utapata kwamba hiyo bone surgery inaoka most of the time because of procedure yenye si sterile. So pathophysiology ya hii inaoka mostly. So basically the pathophysiology of osteomyelitis involve an 80% or 70 to 80% of Staphylococcus aureus infections. That is a bacteria. Also we have others which account for the 20%, that is protease, and Pseudomonas, as well as the E. coli, Escherichia coli. Okay. So the initial response to infection is inflammation. So it is just as the other infections. Then increased vascularity, that is more blood, that is more veins, blood being got there, and edema after 2 to 3 days. Thrombosis of the blood vessels occur in the area, resulting in ischemia with bone necrosis. The infection extends into the medullary cavity under the periosteum and may spread to adjacent soft tissues and joints. Unless the infective process is treated promptly, a bone abscess will form. So the resulting abscess cavity contains dead bone tissue, which we call the sequestrum, which does not easily liquefy or drain. Therefore, the cavity cannot collapse and heal. Therefore, as occurs in soft tissue abscesses, new bone growth, in brackets, involucrum, forms and surrounds the sequelistrium. Although healing appears to take place, a chronically infected sequelistrium remain na produce recurring abscesses throughout the patient's life. This is called chronic osteomyelitis. So clinical manifestations za septicemia ni the osteomyelitis rather, when the infection is bloodborne, the onset is usually sudden. Manifestations include septicemia, that is chills, high fever, rapid pulse, general malaise. So of course kuna fever kama nimepitia kwa damu. Kama of course we know it's a infection from Streptococcus aureus, or those are the 20% Pseudomonas or protease, or the other species which is E. coli. So the infected area inakuwa painful na ina swell na inakuwa tender. Kuna rapid pulsating pain yenye ina increase as a result of pressure of the pulse. Unajua pulse itaanza kuform kwa usa. The area is swollen, warm, painful, and tender to touch. Patient with chronic osteomyelitis presents with continuously draining sinus and experiences recurrent periods of pain, inflammation, swelling, and drainage. So basically, ushike vitu tano: fever, pain, swelling, inflammation, pus, draining. Diagnosis yake of course ni x-ray, kuna MRI, magnetic resonance imaging. We have blood studies. So blood studies, of course, because we know it's an infection, we will have elevated what? WBCs. That is leukocytes, and also a sedimentation rate. Also wound and blood culture studies to identify appropriate antibiotics. So prevention of osteomyelitis. Of course, if elective orthopedic surgery should be postponed if the patient has a recurring infection. So for instance, if we find a patient with UTI, sore throat, or any other infection, recent history, any surgery which is elective for orthopedic ought to be postponed because of the risk of getting osteomyelitis. Also, during the surgery, of course, the environment should be very sterile, clean, sterile. Also, prophylactic antibiotics should be given before the surgery or after, 24 hours after the surgery. Also, urinary catheters should be removed as soon as possible to reduce the incidence of hematogenous spread of infection. Hematogenous, we say, spreads through. Hematogenous spread of infection spreads through.
Hematogenous.
Yes.
Mbona sindi swali yako?
Hematogenous infections are spread through blood. So, urinary catheters, for our listeners, should go through, should be maintained as sterile as possible and should be removed as soon as possible. Aseptic postoperative wound care, of course, we have prompt management of soft tissue infections, and also patients who have had hip replacement surgeries should undergo dental procedures and other non-invasive procedures, as is cystoscopy, with prophylactic antibiotics. So what is the medical management? Antibiotics first. Second, control pain. Ya tatu ni general supportive measures kama kupea hydration, diet yenye iko rich in vitamins. Si antibiotics ni inatumika kwa infections. Pain lazima juu huyu mtu atasikia uchungu. Pia wapeana hydrations, na pia kuna vitamins, kuna correct anemia kama iko. Pia kuna kuimmobilize penye kuna hiyo shida, that's osteomyelitis, to reduce discomfort na reduce further fractures. Pia kuna warm wet socks for 20 minutes several times a day to increase circulation. Surgical management. Basically, the affected bone is surgically exposed. Hiyo pasi inatolewa na inakuwa inaoshwa na saline, sterile, normal saline solution. Antibiotics pia anapewa. Then kuna debridement kama ni chronic osteomyelitis, and if the debridement is necessary, debridement is removal of the dead tissue. Then kuna assecurectomy, removal of a nerve involucrum to enable the surgeon to remove the sequestrum. Sequestrum tumesema ni ile bone ishaharibika due to the infection. Inakuwa performed. Then wound irrigation using saline. Specific nursing activities include kuassess risk factors, relieve pain na kuimprove physical mobility, na pia kuna kucontrol infection na pia kumfunza patient. So sasa tuko kwa fractures. That's another topic. So fractures, a fracture is any break in the continuity of the
bone.
Classification of fractures. They are classified according to location, type and direction or pattern of fracture line. So inakuwa classified mara tatu: location, type na the direction of the fracture line. Location, long bones can be described as having three parts. Proximal ni part ya chini, si ndio? Ya mbele ama chini. The mid shaft ni katikati hapo, around hapo. Then proximal, the distal ni juu ama nyuma. A fracture of the long bone can be described in relation to the position of to its position in the bone. So kuna proximal, distal and mid shaft. So types of fractures. So to classify according to the type, we can this is in relation to its communication to the environment, degree of break in the continuity of the bone, character of the fracture, pattern of the fracture line. So kuna open fractures, hiyo ina communicate to the environment, iko very open, ndio, because ina penetrate the skin na inaonekana. Close fracture ni fracture yenye ionekana kwa skin, ndio. That's communication to the environment. That's a type of fracture according to communication of the environment. Degree of break, kuna incomplete, hiyo inaitwa green stick, na kuna complete. Character of fracture, which can be described as comminuted, that is impacted ama segmental. We will see the pictures for those. The pattern of fracture line can be described as transverse, spiral or oblique. So clinical features, of course, mtu mwenye ako na fracture atakuwa na pain due to muscle spasm. Yes, atakuwa na discoloration of the skin most likely, which we call ecchymosis due to bleeding into tissues. Pia atakuwa na swelling due to hematoma formation. Pia atakuwa na loss of function due to pain and deformity. Atapoteza function most likely. Na pia atakuwa na deformity. Na pia atakuwa na shortening because of the contraction of the muscles that have attached above or below the site of the fracture. Pia most likely atakuwa na crepitus. When the extremity is examined with the hands, a grating sensation inaweza kuwa felt na it is caused by the rubbing of the bone fragments against each other. Diagnosis yake ni gani? Of course, x-ray na pia history of fall or a road traffic accident, trauma. Then specific types of fractures, tuko na fracture inaitwa so we have to know these ones. We have a fracture called avulsion. Yes, avulsion is a fracture in which a fragment of the bone has been pulled away by a ligament or a tendon or its attachment. So may notice ligament of the bone imekuwa pulled away by a ligament. Okay, sorry, a fracture in which a fragment of the bone has been pulled away by a ligament or a tendon or its attachment. So ni tendon tu imekuwa pulled away, hivyo imekuwa pulled away, pull away the fragment of the bone. Compression, a fracture in which the bone has been compressed, seen in vertebral fractures mostly, the vertebral column. Stress, a fracture which results in repeated loading without bone or muscle recovery. So we have a picture of an impacted fracture. impacted fracture there. An impacted fracture, bone fragment is driven into another bone fragment. So you can see that's a green stick fracture. Green stick, we said it's an open, or it's an incomplete, rather it's an incomplete fracture. Yeah. So green stick fracture is a fracture in which one side of a bone is broken and the other side is bent. It's an incomplete fracture. That's green stick. Closed fracture, it's not open to the environment. Open, you can see the bone outside. Open fractures can be graded according to the following criteria. Grade 1 is a clean wound with less than 1 centimeter long. Grade 2 is a large wound without extensive soft tissue damage. Grade 3 is an highly contaminated, which has extensive damage to soft tissue and is the most severe. We have an extracapsular fracture. The bone is broken outside of the joint, rather. Intracapsular is broken inside the joint. Comminuted is where the bone is splintered into fragments. You can see. Longitudinal fracture is where the break runs parallel to the bone. You can see longitudinal fracture. Yes. Transverse, that is transverse, it runs across. Oblique, you can see it goes slanting. Then spiral in a coil. Yeah. Pathological fracture, it occurs when the break is at the site of the bone disease. Mostly it occurs due to the disease. So we have the depressed fracture is when a piece of the skull is broken off and driven inwards. You can see that one. So bone healing. So we will continue in our next video on bone healing, where we will basically cover how the bones are healed, the fractures, repairing, and all other anything which we have not covered in our course outline today about orthopedic nursing part 2. So we will go up to amputation, and it will be the end of this video. Thank you for watching. Thanks for the contributors.